Sorry, VIP, but I always start with my nurses. How is everyone? How are the midwives? Where is the midwives? Where are the nurses? Muli Gomite. Gomite. Thanks for looking lovely. We've already taken a moment of silence to remember Tony and Ali, our nurses who had served the NHS and private services both for over 10 years. We send our sincere condolences to the families. I know very well that we've already buried Ali, and Tony's funeral is in Uganda on the 13th of August. So our condolences to the family and loved ones. Distinguished guests, Lord Mayor, our wonderful representative from the embassy that has stood with us since 2020, Deputy Lord Lieutenant, CEO West London, Inclusion Lead, Chris, Executive Director for NMC, my previous matron in East London. Welcome everyone. Without further ado, I've been asked to invite the Mayor of Wandsworth to come and give us her wonderful speech for this evening. We want to be on time so that the President's speech can close up at the end. Thank you, ladies and gentlemen. I love you all, and thank you for coming.
Good evening, everyone. It is a great pleasure and privilege to be here with you this evening at your 6th annual general meeting. And this year we've come together under a powerful and inspiring theme: celebrating service, honouring excellence, and shaping the future in global health. These words capture who you are as an association and the extraordinary contribution you make here in the United Kingdom and in Uganda. Established in 2020 in the wake of the COVID-19 pandemic, the Ugandan Nurses and Midwives Association UK emerged during one of the most challenging periods in modern healthcare history. At a time when nurses and midwives across the world were carrying immense responsibility, your association created a platform that brought together Ugandan nurses, midwives, and students practicing and training in the UK. Over the past 6 years, you have built far more than a professional network. You have created a community that supports, uplifts, and empowers its members, whilst also making a meaningful contribution to society. Your dedication is evident through your community-based healthcare initiatives in the UK and Uganda, your support for internationally educated nurses as they integrate into the UK practice, and your commitment to mentoring the next generation of healthcare professionals. These efforts demonstrate professional excellence, generosity, compassion, and leadership. Nurses and midwives are often the backbone of healthcare systems, whether providing care at the bedside, supporting families, leading public health initiatives, or advocating for patients. Your work changes lives every single day. I would also like to recognise your growing influence in national and international policy discussions. Recently, members of your association participated in the parliamentary review of the UK's international health worker recruitment practices. Your involvement helped ensure that the voices and experiences of internationally trained healthcare professionals were heard. The inquiry generated important recommendations for both the NHS and independent health providers and highlighted the vital contribution international staff make to the UK healthcare workforce. You have also actively engaged with the Global Fund initiative, demonstrating your commitment to improving health outcomes beyond national borders. It was wonderful to see representatives attending the celebration event at the Houses of Parliament on the 8th of June this year, recognising the UK's commitment to the Global Fund's work in the fight against AIDS, tuberculosis and malaria. This engagement reflects your understanding that healthcare is global, diseases do not respect borders, and neither should our compassion, collaboration or commitment to improving health equality. As we celebrate your achievements, it is also important to reflect on the values that will shape the future of healthcare. One of these values is allyship. Allyship is about standing alongside one another, particularly when community members face barriers, discrimination, or exclusion. It is about listening, learning, and taking action. We must continue working together that inclusion is not just an aspiration, but a reality experienced by every member of staff. An inclusive NHS is a stronger NHS. And as we look to the future, let us remain united in our purpose, confident in our values, and proud of the difference we make. Tonight is a celebration of service, it is a celebration of excellence, and it is an opportunity to continue shaping a future where global health is strengthened through partnership, inclusion, and leadership. To all the members of the Ugandan Nurses and Midwives Association UK, past and present, thank you for your dedication, your professionalism, and your unwavering commitment to improving lives. I have spent some time in your wonderful country and hope to visit again. Both my mother and my sister-in-law are also nurses. I wish you a successful AGM and every success in the years ahead. Thank you and enjoy the evening.
Thank you very much, Colonel Jane Davis, Vice Lord Lieutenant for Greater London. Colonel Jane Davis has captured quite eloquently the essence of why we're here today and the benefits for all of us to come together within the NHS, different stakeholders, to improve patient care. And I think a lot goes in with so much to do. Thank you very much.
Madam President, Representative of High Commissioner, Your Worshipful the Mayor, distinguished guests, ladies and gentlemen, good evening. It's a great pleasure to join you tonight at this 6th Annual General Meeting, celebrating the remarkable work of the Ugandan Nurses and Midwives within the United Kingdom Health Services. His Majesty's Lord Lieutenant of Greater London, Sir Kenneth Elisa, was unable to attend but asked me to represent him. And as a nurse of over 50 years, I'm delighted and honoured. So thank you for allowing me to be part of this very special occasion. The NHS last week celebrated its 78th birthday, and it could not have survived without the significant contribution of the diaspora and internationally educated nurses and midwives from across the globe, including those from Uganda. Tonight is more than a celebration. It's a recognition of a profession that stands at the heart of our healthcare system. Every day, nurses and midwives provide skilled care, comfort, hope and dignity to countless individuals and families, whether in busy hospitals, health centres, maternity units, emergency departments or in communities. Your commitment saves lives and transforms futures. To young nurses and midwives here this evening, I encourage you to embrace lifelong learning, uphold the highest ethical standards, and never lose sight of the compassion that brought you into this profession. The future of healthcare depends on your innovation, your integrity, and your commitment to excellence. To the more experienced professionals amongst you, thank you for mentoring the next generation. Your wisdom, leadership and example continues to inspire those who follow in your footsteps. As we enjoy this evening of fellowship and recognition, let us remember that every award presented, every achievement celebrated, and every success story shared represents countless lives touched through kindness, competence and dedication. I wish the Ugandan Nurses and Midwives Association continued success in the coming year. Thank you and enjoy the rest of the evening.
Thank you, Madam Mayor. Thank you. Can we have now the representative from the Uganda High Commission, Mr. Stephen Sewinya, Honorable Stephen Sewinya, to come and give us a few remarks, please, a few words. Thank you.
Good afternoon. First, to correct two issues. One, my name is Nkaivu Senabulia, not Sebunya, Stephen. And I'm a Minister Councillor at the Uganda High Commission. For those who don't speak diplomacy, Minister Councillor is one grade below Ambassador, and I've just done my promotional interviews to be promoted to the next grade. The Vice Lord Lieutenant of Greater London, the Lord Mayor of Wandsworth Town, and the President, directors and members of the Ugandan Nurses and Midwives Association in the UK, distinguished invited guests in your respective capacities, friends of Uganda, ladies and gentlemen, good evening. When I was preparing to come here yesterday, somebody told me that Ugandan nurses and midwives can dress to impress.
Yeah.
And I must say, I'm not disappointed.
Right.
Thank you for looking elegant and for ably representing the best of Uganda in the UK. The World Health Organization and many other institutions in healthcare refer to nurses and midwives as the backbone of the global healthcare system. Indeed, the World Health Organization goes on to highlight, and I quote, "Nurses and midwives are central to primary health care and are often the first and sometimes the only healthcare professionals that people see. And the quality of their initial assessment, care, and treatment is vital. They are also part of their local community, sharing its culture, strengths, and vulnerabilities, and can shape and deliver effective interventions to meet the needs of patients, families, and communities." End quote. I'm very pleased, therefore, to join and address you this evening at the 6th Annual General Meeting and Celebration, whose theme is celebrating service, honoring excellence, shaping the future in global health. I bring you warm greetings from the staff of the High Commission, particularly from the High Commissioner who was unable to attend due to other commitments. They all wish you fruitful deliberations and happy celebrations, and look forward to positive engagement, collaboration, and partnership as you start your 7th year of the association's existence. Allow me at this moment to extend our sympathies and condolences to you on the loss of two distinguished members of the association, Nurse Tony and Nurse Ali. We have been appraised that both served the community with commitment and dedication for over 10 years. May their contribution to nursing and the Ugandan Diaspora Health Network not be forgotten, and may their souls rest in eternal peace. Ladies and gentlemen, the global public health ecosystem continues to tussle with many challenges and emerging issues. These include, but not limited to, armed conflict and geopolitical crises, which displace people and generate healthcare delivery problems. Increasing cases of respiratory and cardiovascular illnesses, the increasing phenomenon of antimicrobial resistance, which weakens the administration of modern medicine, increasing instances of non-communicable diseases, epidemics and pandemics, mental health conditions, etc. Amidst these and other challenges, health caregivers, including nurses and midwives, are expected to adapt and provide the best health care possible. Many times, despite best efforts, you get overwhelmed. But we don't give up, because your training and calling is to save life, even in the most difficult of circumstances, and sometimes at extreme personal cost. When we speak of service to be celebrated, it does not get better than that. You are our saviors and heroes in the critical times when we have the most need to preserve our precious lives. You deserve the best. Multiple sources indicate that as nurses and midwives, you constitute about 90% of the global healthcare workforce. As such, you should and you must be part of efforts providing solutions and shaping the future for global health delivery, particularly primary health care. For example, we have to be clear on what your roles are for curtailing the spread of infectious diseases and what space you occupy with regard to leveraging new technologies, including telemedicine, artificial intelligence diagnostics, and digital surveillance. As I conclude my remarks, allow me, in the spirit of recognizing and honoring excellence, to commend you all for the excellent and remarkable work you have done towards the service of the United Kingdom and Uganda. From information available to us, your association is doing very commendable job. Commendable work, particularly in Uganda, in the following areas. In March this year, you launched a foundational oncology training program with a clinical team scheduled to travel to Uganda in November, in a partnership with the Peace Foundation, to deliver specialized oncology training at Mbarara, Masaka, Jinja, and Guru referral hospitals. An eye camp was successfully conducted at Zambia Police Barracks in March this year, where over 150 members of the public and police officers received treatment. There is an ongoing capacity building and innovation project at the Mental Health Hub in Zambia. We have been informed that this initiative continues to receive strong support from the Director of Health Services in the Uganda Police Force. You continuously provide first aid support at diaspora events across the UK through your various teams. There is an ongoing monthly public health awareness in the diaspora community and promoting preventive health and well-being. And the recent engagement between the association's leadership and the Permanent Secretary of the Ministry of Health, Dr. Charles Ayume, on strategies to strengthen the role of the diasporans supporting Uganda's healthcare are all welcome efforts. These are not small interventions, and the government of Uganda welcomes and values this partnership, and we look forward to enhancing this collaboration. We thank you and applaud the association for turning your professional expertise into tangible impact, both here in the UK and back home. We remain committed to supporting your efforts as you continue to serve with compassion and excellence. I thank you.
Thank you, Mr. Stephen Sinablia, Honorable Stephen Sinablia, for gracing us with your presence. The Uganda High Commission is an important partner for the association, as well as many community sort of stakeholders that work hand in hand with the Uganda High Commission. So I would like to extend my heartfelt gratitude to the embassy for all of the conversations, interactions we've had with the Uganda High Commission, and the impact, obviously, of our work that we share with the embassy and your support towards the advancement of diaspora healthcare. And as my colleague Primrose mentioned earlier, we have the Doctors Association, the Allied Health Association. All of those associations were brought together with the support of the embassy, and we have done a lot of amazing work between the United Kingdom across to Uganda as well. And I would like to extend a special invitation to anybody here who is within the healthcare industry, so you're a nurse, a midwife, or a doctor, or a physiotherapist, and you would like to join any of these associations, because they bring much strength when we come together and we learn a lot from one another. Personally, as I said, I'm a professor at the university, and I have mentored a number of people, both within my community and outside my community, who want to access higher education. And that is something that I'm really proud of doing, really extending that support to others. At this point in time, I would like to invite Mr. Chris Dixie. As I say, Mr. Chris Dixie is the Executive Director for Professional Standards for the Nursing Midwifery Council, recently appointed, and Chris recently was with the Care Quality Commission. Please, can we put a round of applause and welcome Chris Dixie. Thank you.
Great, thank you very much. I was just saying to Justine, I was going to cancel coming tonight because for some fun reason I've lost my voice. I've been watching too much football, and I think I'm growing old and I need to stop shouting. But I didn't want to miss tonight because as I was talking to just saying, it's so important to come and celebrate people who are doing great things in health, especially Uganda. And one thing I would want to start saying first is, I think I've been adopted by Uganda. I've been on a journey with Uganda, I think, since 2012. And I think I've met almost everyone, from your president's wife, your health secretaries, permanent secretaries, and every person I've met from Uganda has been welcoming. That's why I've said, I believe I've been adopted by Uganda. So thank you for inviting me today. And I'm going to just spend a few minutes just doing some reflections, really. I'm a nurse by background, and I'm proud to be a nurse, and I've seen some people I've known for a long time. And like I said, when we started talking about Uganda, when I was working in East London NHS Foundation Trust, then it was just a dream. And I'm glad to say actually that dream has come to pass, and seeing all of you here, that's a sign that actually the dream continues, and you are all still dedicated and committed to doing so much for the NHS, but also doing so much more for your home country in Uganda. So thank you for doing that. Today we celebrate services. We celebrate the country's nurses and midwives who rise before dawn, who work through the night, who care for patients in these urban hospitals and remote rural communities, often under challenging circumstances that some of the people have already spoken here have reflected on. But we also want to celebrate the professionals who bring comfort to the sick, and all of you bring hope to families and dignity to those at their most vulnerable moments. And I want to reassure and say again, service in nursing and midwifery is more than a profession, it is a calling. If you ask every person who has become a nurse, who has become a midwife, on why they decided to become a midwife or a nurse, I can tell you 10 out of 10 people tell you that there was something deep within themselves. They felt that it was a calling. It wasn't about money, it wasn't about anything else, but it was about that sense of purpose, the sense of wanting to give back to the community. And that's why we've got nurses and midwives in this room, and that's why I'm so proud to be talking to all of you today. And also today, we are going to recognize people who have done some great work in the professions, and their achievements remind us that excellence is not an event, but a continuous journey of learning, improvement, and dedication. By honoring their accomplishments today, we inspire others to pursue the same high standards and commitment to quality care. The world is facing increasingly complex health challenges, as you all know, from emerging diseases and climate-related health impacts to mental health needs, health inequalities, and workforce pressures. Global health requires bold leadership and innovative solutions, and the world will continue to be challenged. But I honestly believe, with all of us here and all of you here, nurses and midwives and doctors and everyone else who works in healthcare, I think we can meet the challenges. We are going to be challenged like the pandemic showed us, but I can tell you we are still here. I know he has lost so many people during that time, but I also believe that we've got all that we need in order for us to continue pushing, in order for us to continue improving, in order for us to continue innovating. So thank you so much for everything you do, and thank you for having me today. And keep on doing what you're doing for the NHS, for Uganda. You know, we've got nearly 860,000 nurses and midwives and nursing associates in our registered NMC. That's a huge number if you consider how many people work in the NHS. And we've got a lot of people who have come from all parts of the world, including Uganda, who continue day and night contributing to the NHS. And the NHS is much stronger because of midwives and nurses who are in this room. So thank you for everything you're doing, and thank you for everything you continue to do. And enjoy the night. Thank you.
Thank you, Mr. Chris. Can we give him another round of applause, please? Thank you very much. I've just heard excellent news from the Master Chef that our food is actually being engineered now. It's being manufactured on a conveyor belt, going through stages, and eventually that food is going to come to us. And I know it's been a long afternoon, extremely hot, and most of you probably are in the zone of, too much talking. We need to make our stomachs happy, and I've got good news for us that that food will be with us eminently. I would like now to invite our last speaker for today, a VIP, Miss Maria O'Brien, the Chief Executive for the West London NHS Trust, to come and give us a few words, please. Thank you. Can we give a round of applause as she comes up?
I'm really conscious that I'm now standing between you and dinner. So I could be really quick and say ditto, but I won't. But thank you. Wonderful to be here today, and I'm a chief executive, but I'm also a nurse. And coming to an event like this means a lot to me, because anytime I'm invited to an event where there's nursing staff, it feels like I'm coming home, standing here amongst fellow nurses. And nursing has shaped who I am today, so even though I'm now a chief executive, those values have stayed with me forever. And I want to speak to that place for a moment, because Ugandan nurses and midwives make such an extraordinary and enormous contribution to the NHS, and we shouldn't forget that. You bring skill, you bring strength, you bring warmth and a deep sense of humanity to your work, and you hold teams together, you support patients through some of the most joyous parts of their lives, but also some of the most challenging and difficult parts of their life, and you bring professionalism, and that lifts the standards of care amongst you all, and please keep doing that. And in my role, I have the pleasure to go and see some amazing services every day, and I see what contribution that you make. Clinical expertise matters enormously, but don't forget those things, those kindness, compassion, that human connection matters so much to the people that you look after day in, day out. And those are the things that they will remember. You know, we see over the years, I've been qualified now for 40 years, so a long time on the register. But, you know, in that time, I've treated many patients, and of course I can't remember them all, but they will remember you, so hold that in your hearts. And I'm glad some of my own staff are here today. Great to see you, thank you very much. But I want to say to you that your contribution does matter, and we're really grateful to have people like you in our organisation, because you make us richer and more diverse. So thank you, John, and to others. So your theme this year about celebrating and honouring excellence and shaping the future in global health, I think captures exactly what is embodied in the association and all that the association promotes. And the fact that we remain deeply rooted in the UK but deeply connected to home is such a powerful combination, and you should be really proud of that. Look, as a Chief Executive, I lead a mental health and community trust, so that's what my trust does. And I'm particularly inspired by that diaspora project this year, which is the renovation of the Nsambi barracks to create a mental health hub. So for me, that's something that's really special, and I'm really pleased to hear about. And across the world, you know, we've heard it very much, there should be no health without mental health, but yet we know that's not always the case. So I'm really pleased to hear that you're bringing some of that work back to Uganda and making sure that your local people have got good opportunities to recover and to live well. And it's much more about bricks and mortars, it's about creating hope, it's about tackling stigma, strengthening communities and ensuring that people experiencing mental health have got somewhere to turn. Representing prevention, compassion and dignity in action, and that, I think, sits at the heart of what a nurse is all about. So the fact that you're leading this work whilst continuing to make such a big contribution to the NHS, I think speaks volumes about the commitment that you have. You're transforming lives here in the UK, but you're also doing it back at home, and that's a remarkable legacy and one that deserves recognition and celebration. So, thank you very much for the invitation. I'm delighted to be here. Have a lovely, lovely evening. I'm going to stop speaking so that you can hopefully have something to eat very soon. Enjoy the night. I'm afraid I probably won't be staying with you to boogie on down, but I'm sure you'll have a great time. But thank you very much for inviting me. Love you all. Thank you.
Thank you, Ms. Maria O'Brien, for that excellent speech. By show of hands, guys, how is everybody feeling today? Are you generally happy? Are you happy to be here? Or you would have preferred to be in the park enjoying the very hot sun today? Show of hands.
Thank you.
There's a few. Being in the park or being here, mingling, meeting people, and I'm sure there's going to be a lot of conversations today. My apologies. I'm now going to invite our last speaker, Ms. Maria O'Brien, was a penultimate speaker, but our last speaker for today, our VIP, Ms. Tina Jegedi. Ms. Tina Jegedi is the Joint Inclusion Lead for We Children Health. Then after that, we're going to have an excellent conversation in terms of musicality by our lovely band, Sabula. But before that, I will tell you much more about the raffle ticket. For those of you who are joining us, we're running the raffle ticket that I think everybody ought to know about. Thank you, Ms. Tina. Thank you.
Thank you. So I am the speaker, and I'm just keeping it from your dinner, so I'm going to be speaking very quickly and probably keeping it short. But what a privilege it is to be here this evening. And I do really want to say, well, it's a real privilege to be here. And I want to say welcome, I suppose, to all the distinguished guests, we've heard it already, and to my fellow Ugandan nurses and midwives. I'm Nigerian, but I always feel like I'm from Uganda, having been there a number of times, and to Nebi. So today is really about celebrating our profession and to recognise our collective power in shaping the future of healthcare and maternity care. As Black and minority ethnic or global majority nurses and midwives, we are at the heartbeat of progress, compassion and excellence. You need to know and you need to acknowledge, pat yourself at the back, your contribution to not just enhance care, they transform lives. You've heard that already. So let all of you and all of us be proud in ways which make healthcare stronger. Because what you're doing is making it more inclusive and making it more effective. I was asked to focus on midwives because, as you know, midwives are at the very heart of maternal care. And I do want to point this out. Recent findings from the Race Health Observatory have highlighted some troubling disparity in the outcomes for Black